Hello, everyone. Welcome. My name is David Wilson. I'm managing principal of Fund You Up, and I am excited to tell you today about our newest audit contingency-based program for the medical industry, the medical underpayments program. And it is designed to recover lost revenue that should have been paid by insurance companies to medical providers on a contingency basis. So welcome to all the medical providers. If you're a medical provider, if you are an executive that works with a provider, welcome. And welcome all of those who work with medical providers, maybe consultants, CPAs, accountants, what have you. Not going to take too long. I'm going to give you a brief overview of how this all works and how it benefits the medical community. Let's get started. And I figure we get started with just an overview of what a medical underpayment actually is. So for those of you who work for medical providers, are medical providers, you're likely aware of this. Some of those who may not, but just work with them, may not be aware of this. So I want to go over this for their benefit as well. It's two main ways that medical providers get paid. They get paid by insurance companies, and they get paid by patients, the patient pay portion of the bill. And that's due upon receipt. However, sometimes those payments are late. Sometimes those payments are wrong, or the code is wrong, especially when you're working with insurance companies, as many of you know. And those payments end up being late. They end up being delinquent, or they end up being short. So you don't receive what you expect to receive for the services rendered. Now, most providers do have internal methods by which they collect, investigate these payments. It could be internal software, it could be external software, it could be internal collections, so a collections team or an external collections team that kicks in somewhere between average 60 to 120 days out. Sometimes it's 30 days, sometimes it's 180 days, but usually there's some method or methods by which to recover all of the revenue that the provider is due. Unfortunately, doesn't always work out in favor of the provider. Sometimes you don't recover all of those patient pays, and sometimes you don't recover all the insurance pays, or you don't get paid as much as you should get from the insurance companies, and that results in a charge-off. So the last thing I said is what we focus on. We're only focusing on the insurance company receivable. That's it. So a lot of excuses. The code was wrong. The inquiry was late. I'm sure you've heard it all. But we're focusing on the medical underpayment, the difference between what the insurance company and you have contracted to receive and what you actually received from the insurance company. That's all we're focusing on, not the patient pay portion of your revenue. So how does our program work? Well, we use software as well that kicks in after all of your methods in place are exhausted. So we're not replacing anything. We're just coming after everything is exhausted. And we are going to focus on your insurance contracts, how much you should have been paid for each of your billing codes. So we're going to go billing code by billing code by billing code to see should you have been paid more in this area? And then we're going to pursue that and help you recover as much of that revenue as possible with no upfront cost. So that revenue comes directly to you from the insurance company. It does not go through us. The only thing we will receive, we'll earn 30% of what we recover, again, on a contingency basis. And if you do some quick math, that can be a considerable amount of money depending on how much revenue you have with insurance companies in your practice. All right, so who qualifies for this? I know you're probably getting a little excited now. So who qualifies? Well, you have to be in the United States, headquartered in the US, ideally doing more than $10 million in insurance payments per year. We evaluate each provider on a case-by-case basis. So if you're really interested, we'll look at, have a conversation with everyone. But to make it worth your while and to make it worth our while, you should be doing upwards of $10 million per year with as many billing codes as possible. The more, the better, because that's going to allow us to spread out our services across multiple billing codes to really pull in as much revenue for our client as possible. Large medical providers, large medical groups, urgent care facilities, hospitals. These are great candidates for our program. So what should you expect? Well, here are the results that you should expect from our program. Somewhere between 10 to 20% is what we're averaging of your yearly insurance company revenue. So remember, we're going back in time, and we're looking at all the revenue you brought in from insurance companies and assuming it's low, assuming it's not what they were contractually supposed to pay. So that's why that's why the recoveries can be so plentiful. And even on the low end of 10%, doing math, that's a considerable amount of money that's coming back to the practice, back to the group, back to the hospital. And again, all on a contingency basis. So in theory, if we find nothing, it has cost you nothing. You've changed nothing. You've added nothing. You've taken nothing away. It's just that we have spent our time and our resources to look. We found nothing, and you return doing what you were doing before, knowing that you're being paid properly. All right. Big question. What's the next step? So you need to schedule an appointment with us. You can click the link in the description, or you can give us a call. Phone number's there. The link is in the description where you're watching this video. Click on that, schedule an appointment with our audit team, and we'll get you rolling. And we'll start the recovery process to see how much we can get for your practice, for your client, for your hospital, whatever the case may be. So thank you for watching. Again, I am David Wilson, managing principal of Fund You Up, talking about our newest contingency-based audit program, the medical underpayments program for hospitals and medical providers to help them recover as much lost revenue from insurance companies as possible. Thank you for watching, and you have a wonderful day. We look forward to working with you.